Hello and welcome to my channel. In this video we will be looking at AQA Alevel Psychology Specimen 2 Paper 1 Exemplar Answers for Psychopathology, which you need to know for AQA Alevel Psychology. I hope you enjoy this video and find it helpful. Let's get started. Please note that these answers have been produced with knowledge of the mark scheme but have not been approved by the mark scheme themselves. There are 3 assessment objectives, AOs, in psychology. In this video they are color-coded. AO1 Knowledge, purple. AO2 Application, blue. AO3 Evaluation, red and green. A researcher wanted to see whether cognitive behavior therapy was an effective treatment for depression. 20 depressed patients who had all recently completed a course of cognitive behavior therapy were involved in the investigation. From their employment records, the researcher kept a record of the number of absences from work each patient had in the year following their treatment. This was compared with the number of absences from work each patient had in the year prior to their treatment. Those patients who had fewer absences from work in the year following their treatment than in the year prior to their treatment were classified as improved, plus. Those patients who had more absences were classified as deteriorated. Those patients who had the same number of absences were classified as neither, 0. The results of the investigation are included in Table 1 below. The researcher decided to use the sign test to analyze the data. Question 1. Explain 2 factors that the researcher had to take into account when deciding to use the sign test. Refer to the investigation on the previous page in your answer. 4 marks. One factor that the researcher had to take into account when deciding to use the sign test is that the data is nominal, as patients were assigned to one of 3 categories: improved, deteriorated, or neither. A second factor that the researcher had to take into account when deciding to use the sign test is that research is testing for difference in the number of absences in the year following and prior to treatment. Question 2. Calculate the sign test value of S for the data in Table 1 on the previous page. Explain how you reached your answer. 2 marks. S equals 5. This answer was reached because the most commonly occurring sign is plus, 12, and the least frequently occurring sign is 5. The zeros are disregarded. The total for the least frequently occurring sign is the value of S equals 5. Table 2. Critical values for the sign test. For significance, the value of the less frequent sign is equal to or less than the value of the table. Question 3. With reference to the critical values in Table 2, explain whether or not the value of S that you calculated in response to Question 2 is significant at the 0.05 level for a 2-tailed test. 2 marks. The value of S, 5, is not significant at the 0.05 level because the critical value is 4. As the calculated value is higher than and exceeds the critical value, the result is significant not at the 0.05 level. Question 4. The investigation above is based on secondary data. In what ways would the use of primary data have improved this investigation? 3 marks. Primary data is obtained first-hand from the participants themselves and is therefore more likely to lead to greater insight into the patient's experience of treatment and whether they found it beneficial or negative. Primary data is more likely to match the researcher's needs and objectives because questions, assessment tools, etc. can be specifically tailored to them purpose if research, such as an interview, may produce more valid data than a list of absences. Question 5. Outline the implications of psychological research for the economy. Refer to the investigation above in your answer. 5 marks. Psychological research may lead to improvements in psychological health treatment programs, which may mean that people manage their health better and take less time off work. Absence from work costs the economy an estimated $15 billion a year annually, and much of this absence is due to mild mental illness, e.g. stress, anxiety. If research, such as the investigation described, suggests that depressives are better able to manage their condition following CBT and return to work, then it may benefit the economy to make treatment more widely available, improve funding, etc. Psychological research such as this plays an important role in sustaining a healthy workforce and reducing absenteeism. Question 6. Outline one definition of abnormality. 2 marks. One definition of abnormality is deviation from social norms, which is defined as abnormal behavior that goes against or contravenes laws, unwritten rules, or expectations in a given society, culture, or situation. Therefore, any behavior that does not conform to accepted or expected standards is abnormal. For example, respect for human life, queuing at a bus stop, greeting etiquette, dress codes, personal space. Question 7. Outline and evaluate one other definition of abnormality. 6 marks. Another definition of abnormality is deviation from ideal mental health, which is defined as behavior which fails to meet a particular prescribed criteria for psychological normality, well-being, and good mental health. Jehoda, 1958, proposed 6 criteria of optimal living for ideal mental health, with an absence of these characteristics indicating an individual to be abnormal. The criteria includes an accurate perception of reality, being realistic and objective about oneself and the external world, ability to cope with stress, being able to effectively deal with the challenges of life without excessive stress, environmental mastery, the ability to successfully navigate work, social, and other situations, self-actualization, achieving personal growth and progress, realizing one's potential, positive attitude towards oneself, being happy with who you are and having self-respect and self-esteem, autonomy, being independent, self-reliant, and able to make decisions for yourself. The more criteria someone fails to meet, the more abnormal they are. A strength of deviation from ideal mental health as a definition of abnormality is that it takes a positive, holistic approach to diagnosis. The holistic description of ideal mental health focuses on the entire person and their overall well-being rather than atomized elements and the mere focus on the absence of mental illness. It considers various aspects of an individual's life, including emotional, psychological, and social factors, which can provide a more comprehensive understanding of their mental health. By promoting the idea of optimal functioning and personal growth, this approach encourages individuals to strive for their best selves, rather than merely fitting into a category of what is considered normal. For example, a person with depression might have low self-esteem and not be achieving self-actualization. Addressing the overall deviation from mental health might be a more effective treatment avenue than focusing on specific symptoms in isolation. Moreover, this definition can help reduce stigma around mental health, as it shifts the focus from labeling individuals as abnormal to recognizing the complexity of mental health and the various factors that contribute to it. This can lead to better treatment approaches that are tailored to the individual's unique circumstances, fostering a more supportive and understanding environment for those experiencing mental health challenges. This is a strength because it suggests that mental health should be viewed through a lens of positivity and growth, rather than simply as the absence of illness. By focusing on the ideal aspects of mental well-being, it encourages individuals to pursue self-actualization and overall fulfillment. This approach recognizes that everyone has unique experiences and needs, allowing for more personalized and effective treatment strategies. Furthermore, it promotes a more compassionate understanding of mental health, helping to destigmatize those who may be struggling and fostering a supportive environment for recovery and growth. Thank you for watching. If you have enjoyed this video, please like and subscribe for more content like this. Bye.